honestly, I'm not sure there is anything more that I want to add after our daddy has spoken. I think we are blessed, and I'm being very honest. If we have issues with sexual health from today, it is because it is your fault, and not because we don't have somebody who can tell us what is right or what is wrong if we bring it before him. Let me come this way. If you are bold enough to meet our gardener, this is the challenge. I have no doubt that to get the right direction in this province. If a lady or a woman needs money, I'm sure she'll get the right direction in this province instead of seeking advice elsewhere. You know, we said it, that all these things were within certain confines. Daddy said one of the things, apart from thinking that I want to try not to go outside the marriage, is not telling us practically, those things that you are encouraged to do, as long as you do matrimony, so as not to go outside. And that is the truth. It's the truth. Because there is always flesh. And we always plan ahead, be a step ahead of the flesh. But having said that, I don't know why I was invited since Daddy was here. It's so much. Anyway, I think it's okay. I have some few questions there. And you want to read some of them? If we break down these questions, this one is saying, you mentioned some of the things that could happen, decisions that could happen in Yoruba land. It might affect the quality of personal sexual health in terms of the other types of such diseases. He gave the example. What are the solutions to this? Okay, one of the examples he gave is hypothyroidism. I didn't want to read that particular example, but I said, don't let me worry with hypothyroidism. Or most people know that what hypothyroidism is. But what the person is asking is this: that I said some people would have had shegede. That shegede happens here, but sometimes also affects the scrotum. It's a viral infection. Virus infections, they come and they go. Most times, it's like catarrh and all the rest. It comes and goes. But by the time it's leaving, it leaves behind some damages. That damage affects the organ that produces semen. There are three sources of what comes out when you ejaculate. One of them, which is the most important, is the organ that produces semen, the testicles. That virus affects it. Not in everybody, only in some of those people. Unfortunately, once it is irreversibly damaged, there's nothing that can be done except God just want to reverse it in His own infinite mercy, and that is outside any one of us now this time around. So for most of these disorders, therefore, when they cause irreversible damage, it's difficult to reverse. The take-home lesson is this: let us also watch out in our children, especially mommies, and make sure we take everything that happens in children very seriously. Seek right opinion, especially when it has to do with the testicles and so on. Some people, they have pain in the scrotum. That pain sometimes goes away. It is what's called torsion. The testicles just twist and it gives pain. Many times it untwists itself and goes. If it happens many times, it can destroy the testicles permanently. So when your children have issues that have to do with testicles, reproductive organ, male or female, you must take them serious. That's the take-home lesson for them. For some few, you could actually reverse them. Thyroid problems can reverse medications. But majority of those that will cause affect sexual health may not be regulated. The other thing I want to take home is this. Potency is different from erectile dysfunction. You might have erection. You might release the ejaculate. But what you are releasing might not be potent. So you have good erection. What's coming out might not be potent enough to bring about pregnancy. So you must distinguish those two. The fact that you have erection does not mean you must impregnate. No. And the fact that you don't have erection does not mean you cannot impregnate. Because the other way sometimes of getting the semen, so that you can put your needle into the testicles, withdraw the semen, and push it into the woman. Right? So she gets there and she gets pregnant. This questionnaire is saying, if you check, it's asking about sex enhancement or drugs such as bitter cola, bitter leaf. It is not advised. You see, we are complete. And if we live normally, we don't engage in vices, we should be able to do what is normal. Not to start enhancing such a. Indeed, if you are not taking, it has reverse effects. And apart from that, when you take a sexual enhancer performing the agent, towards the bottom, you've seen that whoever it doesn't need for, we come back to tell you that you have even overdone. So stay within the limits. You don't need sexual enhancer for any reason. And some of them even be fake, really. We have this one that says, can a woman stimulate herself with some when she feels sexual urge? Well, we want to encourage sexual. The first thing is this: don't encourage yourself to be where you should not be. You should be very careful. You already know that where I'm going, what I'm trying to do is such an environment where some unnecessary, undesirable, urges will start to come up. First of all, avoid them. Don't say you want to go and see what will happen. Because when it starts, especially with men, it can be very difficult to stop. For some men, when that urge starts, it can be very difficult to go. So the first thing is don't even go there. But for women, if the urge starts, it's better in doing matrimony. If matrimony, no problem. If you want to matrimony, just too bad. Let the urge also goes his way. But don't go near where you have that urge. That is the key lesson. And women don't have urge that frequently. It is men. Because they keep seeing too many things. Women, when they see, it is only when they perceive that what they see is there is a connection between them and what they see before women have one. But men, whether there's connection or no connection, it's like anytime ready to go. But for women, it's a different ball game. They will never move until they are sure it's a trusted partner. And when they move, they go the whole on. And they still remain there. But men is sharp, and then they leave. They don't even remain. So please don't go near where you think you have that urge at all. When you abstain from sex for 4 to 5 weeks, any problem with that? Absolutely no problem. The body has a way of absorbing those semen. Right? And that's why you see, even those who are saying for sex, you cannot see your wife travel for 3 months. And you are now somebody deceiving you that if you don't go and put that in somewhere, that is problem. It's problem. There is no problem. Nature has a way of reabsorbing it. So don't let everyone just deceive you. You can stay with that sex for as long as you desire. For as long as you desire. It does not really cost you any harm. But if somebody that has been harmed because of it, let me know that this person died because he didn't see a woman to meet. Let us know that. We have some questions on erectile dysfunction. That is failure to achieve erection, right? Not just erection alone, with the right characteristics, turgidity, and for duration as it were. Not erection that comes as if it's flashing you, right? Just come and go. Erection that is sustained and turgid is a big problem in many homes. Big problem. We do know that erection is a factor of so many things. Daddy has mentioned part of it. For men, sight. As he's standing, is erect. Right? So sight plays a major role. And erection comes when you see what you want. You understand? So even if you are not, you don't have erectile dysfunction, they might think you have, but everything you see just piss you off. Now, but some have genuinely erectile dysfunction, genuinely, that even when they see what they want, it is still difficult to achieve erection. And that is the one that we're talking about. And it has two components, physical, psychological. Physically, you just hate this person. You feel this person, by virtue of this person is not clean enough, is this or that, is not. Psychologically, you are defeated. You don't have a problem, as it were, but it is that person that is putting you off. But apart from that, some do because they have medical issues. That's almost getting towards complete loss of sexual performance. Diabetes can be one of them. Some people have gone through surgery, prostatic surgery, and because of those surgeries, some nerves have been damaged. It has happened. Some people have long-standing hypertension. Some people are on some drugs because of high blood pressure that may have some bit of side effect that may affect sexual bonding. A couple came in. The man came. He said he had the right to stay outside. He said, I have one funny tradition. If a man and woman comes, I prefer I quickly take notes from the woman before the man talks at all. But the moment I ask the man says something, I know I cannot get any other information. Except the woman comes at a different time. If you ask her, she will be agreeing. Because you cannot say anything different from what they have said. That's the cultural education that we have. So, but this time around, the man has said everything. And as he stepped out, the man stylishly stepped behind. The man didn't know. And she was telling him, that's everything they said inside. That's not the issue. You know, it was so funny. The man stepped out, and the man stylishly delayed her step. I was like, this guy. Put this on. But if the woman was the first person that spoke, she might have said what the issue is. If he doesn't look at the man's eyes, because Oju can be very terrible. He speaks sometimes like the mouth. Oju ti sọ àwọn yòrò, jẹ́nu ò tí ì sọ. Tí màá bá sọ pé tó bá dún pẹ́kẹ́, you know she will keep quiet. She must obviously, listen, it's biblical. Is it not? She must. In all, is it? Now, so therefore, if you want to get information there from a couple, as much as possible, call them differently, talk to the woman first. The woman to get for the woman is authentic. They said the man is very open type. That will also come and tell you. Now, in the case of dysfunction, therefore, part of physical pain, even on drugs, some medications can cause lots of protest. You need to see the doctor, the counselor, they profile you, know what is your own. Something must be pushing you away. Some people have spinal cord injury. Some people have some kind of trauma. Some people have some kind of pleasant memories, events that still keeps recurring. that each time they see a woman, the thing will not just come. But when they see a man, they start, so many things could have happened. You need somebody, a counselor, to take you through and find out what could have been yours. Is it pathological or physical or is it psychological? And then know what to do. And then lastly, he talked of oral sex to practice sexual exploration. As far as I know, and I stand to be controversial, oral sex is not part of biblical prescription. As far as I know, but I said I might not know everything. So it is therefore a no-no. But the area where we might have to now engage ourselves is position. Traditionally, it is missionary. But missionary, isn't it? Isn't it? Very good. I try to play safe and say, outside things like oral sex comes with some other medical disadvantages. Anything oral sex, anal sex comes with a lot of medical disadvantages. Indeed, some of them are something. If I started the medical, you see that they are huge that you think even medically you shouldn't even go there. But the other positions, I place it, once it is within matrimony, it's okay. It's okay. That is my position. But the one that I do not even agree at all that you even consider is the other one. I like the way, because you cannot get pregnant through anal sex. You don't get pregnant through oral sex. So you therefore tie that act with the way it happens. Whether it is for pleasure or for reproduction, you must tie it through the way it happens. And the only way that I think it should happen is through the normal vaginal sex. That is said some few things about spontaneity. Every man and woman must know their partner's code. A code that when you touch the code like this, oh my God, the door must open. The door must, you must deliberately learn your partner's code. Try to get the code. And some of the code may be dressed. You will see some wives, by the time they come to the room, what you get me? Immediately, that person has known your code. And there is a way you also press her code that there is no how. Even if she has been fighting with not of it, make to press that code. Oh, wait. Only land. That will also say something very important. When you have a good sexual life, so many things keep going smoothly. Even at work, it goes smoothly. You concentrate, you are productive. Even at shop, you are able to count the money better. But when you have challenged the sexual life at home, oh, I'm sorry for you. Honestly, I'm sorry for you. Because in control, the thing that makes you worry, you start simply because there is a problem. He has been denied. So please go back. There is sex therapy that it can be a kind of therapy even at home too. That you must really find a way of using, and that was trying to say. That as long as all these things are within this area, matrimony, then they are good to go. Don't be tempted to to ever exhibit or try them outside, then it becomes a complete capital no. There are many other questions, but because of time, we may have to stop at this. Once again, I thank you for your time.